Welcome back. Now, the Energy Policy Institute at the University of Chicago in India has researched and the impact that the lockdown has had on Delhi's poor and non-migrant population. Now, they found for many, their weekly incomes dropped by 57% as working days plummeted by 73%. Well, to talk more about the findings of this report, we're now joined by Dr. Lee, Executive Director of the Energy Policy Institute at the University of Chicago in India. Thank you so much for joining us. You've also found that a majority of the people that you have spoken to in the month of May have found that their weekly incomes have actually plummeted to zero. Tell us more about the findings, also the impact it's had on the behavior of people.
Sure. Thank you so much. It's a pleasure to be here. Thanks for the opportunity. So we are nearly 2 months into the national lockdown, and many of us are wondering, is it worth it? What are the costs and the benefits of this lockdown? So along with colleagues at UChicago, as you said, we've been studying the impacts of this lockdown on a population of mostly poor, non-migrant workers in Delhi. So these are people who typically earned 3,000 rupees a week and are employed as laborers, drivers, street vendors, as well as in salaried jobs. So we are able to compare data that we collected before the lockdown to data we collected during the lockdown, and that allows us to study some of the impacts. Now, in terms of costs, as you've said, life under the lockdown has been economically devastating. In our data, average income dropped by at least 57%. In the past couple of weeks, 9 out of 10 survey respondents have reported that their incomes went to zero. And so there continue to be great economic costs of this lockdown. But the question is, what are the benefits? And in our data, what truly stands out as a potential benefit of this lockdown is the widespread compliance with public health directives. In the population we study, mask usage increased from about 20% during the peak pollution season to 90% now. Time spent indoors went from 44% to 95%. Hand washing went from 88% to nearly 100%. People are even reporting that they're smoking less. And I highlight these behaviors because these are the kinds of actions that can slow the spread of the virus and ultimately save lives. Right. And these are the actions that need to continue well into the future, even after the lockdown ends.
Right. Dr. Lee, you've also researched about the sort of, mental issues or mental stress that people are undergoing. And that, too, you found that a high percentage of people are undergoing some sort of stress and agitation.
That's right. In our survey, we asked a number of questions relating to mental health. And we don't have pre-period data, but what we could say is that more than 40% have reported feeling anxious or depressed for the majority of the past week, which seems relatively high. And we have to be concerned about the cumulative effects of those types of costs if there are subsequent lockdowns and as this crisis unfolds.
Right. And Dr. Lee, now we're going into, phase 4 of our lockdown. We're waiting to find out what sort of, exemptions will be there, how much of a push will be there for the economy to get back on track. But the impact that it's had on the poor, this lockdown has been devastating in the sense that in your survey, you also found that some of them, a certain percentage had savings that they were relying on during this period. But now those savings are almost completely wiped out.
Yeah, that's right. I mean, given the tremendous economic costs of this lockdown, the economy will have to reopen. And the point that I'd like to make is that we need to make sure that the behavioral benefits that came out of this lockdown are not temporary and are not wasted. So compliance with public health directives must be a priority moving forward. So, for example, people need to continue wearing masks when in public properly at all times. It's going to be uncomfortable. But that's where it's helpful to remember that this is just for the duration of the pandemic, and there will be a future where we don't have to wear masks anymore. And I think that the government can play an important role here. First of all, domestic production capacity of masks can increase. It isn't a short-term need. We'll be needing, it will take a while to win this battle. And people shouldn't feel forced to keep using the same mask over and over again. They should be abundant. They should be free because of the positive health externalities that come out when everyone wears them. So it's going to be very important for us in this battle to make sure that we don't lose those small gains that we made in this lockdown in terms of the changing behaviors.
All right. Well, thank you so much, Dr. Lee, for speaking to us about this report. So that was a report that researched the impact the lockdown has had on Delhi's poor and non-migrant population. Well, with that, time for us to slip into a short break. We'll return with more news updates. Stay with us.